Hey, it's Roberto Miki again, and we've got another great hand question of the week. It's number 31 in our series of questions for medical students, residents, and fellows studying for the boards or in training exams. Well, let's get right into it. It's a radial nerve anatomy question. Which intrinsic hand muscle is innervated by the radial nerve? A, adductor pollicis, B, abductor pollicis brevis, C, flexor pollicis brevis, D, third and fourth lumbricals, or E, none of the above. Well, here's your chance to pause the video so you can think about the question and answer it. There are no muscles within the hand that are innervated by the radial nerve. The median nerve and ulnar nerves are the only nerves which provide motor innervation for intrinsic muscles in the hand. And I learned this very early in my career from a Dr. Susan McKinnon at Washington University in St. Louis. And it sort of inspired me to become a hand surgeon. And she taught this in a very interesting way. She used a tic-tac-toe method of teaching it. And there are three nerves represented by the three columns that innervate the hand: radial, ulnar, and median. There are two functions of every nerve: motor and sensory. But the motor is divided into motor intrinsic and extrinsic, which are seen in the three rows. Motor intrinsic means muscles within the hand that are innervated by that nerve. Motor extrinsic are muscles outside the hand that act on the hand. And sensory is obviously a sensation in that area that's innervated by that nerve. And so this tic-tac-toe grid allows you to memorize or remember which parts or which muscles are innervated by which nerve. So motor intrinsic, which are muscles within the hand that are innervated by the radial nerve, should be represented by an X. And you can see that here. So there are no nerves, there are no muscles within the hand that are innervated by the radial nerve. Now, the ulnar nerve does provide innervation to muscles within the hand that act in the hand. And this is usually tested by asking the patient to separate the fingers or cross their fingers. So that's represented in this grid by finger abduction. And that's written there. The median nerve also provides innervation to muscles within the hand that act in the hand, and that's usually tested by asking the patient to oppose their thumb. And so that's represented by opposition. Now, motor extrinsic, or nerves or muscles that act on the hand that are outside the hand that are innervated by the radial nerve, are basically all of the extensors. So extensor pollicis longus, extensor digitorum communis, and extensor carpi radialis longus, and extensor carpi radialis brevis are all examples of extensors. But I usually just test it by asking the patient to do a thumbs up or an EPL test. And that's represented by thumbs up in this grid. Ulnar nerve also has extrinsic muscles that act within the hand, and that's usually represented by the flexor digitorum profundus to the small finger. And that's represented here by the FDP to the pinky. The median nerve similarly also has muscles outside the hand that are innervated by it, that act on the hand. And I usually test that by testing the flexor digitorum profundus to the index finger. And that's represented by this FDP to the index box. Now, sensory is very easy. Sensory for the radial nerve is basically the first dorsal web space. And you can see that here in this box. Now, ulnar nerve, I usually test sensation at the level of the pinky. And so it's represented pinky. And it can be actually the dorsal or the volar side of the pinky. Now, the sensory test for the median nerve should be done on the index finger, or I usually do it on the index finger. It can be the thumb, index, or long finger, and half of the ring finger, but I classically usually test the index finger volar surface for the sensation test for the median nerve. And you can see this represented by the box saying index finger. But you have to be careful because the index finger dorsal proximal phalanx and metacarpophalangeal joint can be innervated by the radial nerve. So really you need to test the volar surface of the index finger. So the answer to the question is none of the above, E. I hope you learned something. I hope you enjoyed the video, and we'll see you at the next one. Remember to like and subscribe to help support this channel.